Hi, I'm Dr. Nishant Yagick. I'm faculty of in neurosurgery for Marrow, and today we are very proud to bring you a special interview with one of our successful candidates. I would say a lot of people are successful, and I would like to congratulate all of you who've made it. Wish best of luck to those who haven't, but for the benefit of those who haven't, I want to introduce to you the All India Rank 1 this time in INI for neurosurgery. Congratulations.
Sir, good evening, sir. Thank you very much, sir.
So nice to have you with us. And how was your experience? How was the exam experience?
Sir, the exam was quite hard, sir. To me, it is very hard. It was very hard, sir. I
Okay.
thought when I did the first 10 questions, I thought the exam was very easy. I thought why did they give it like that? After that, the scene changed, sir. Totally, it reversed. Because for
Oh,
usually for a single question, I would take at least some 30 seconds, sir. For few
oh,
questions, in this, I took some 2 to 3 minutes, sir.
all
So
right.
I actually wasted some time. So that is, I
No,
had some bad experience, sir. That's why the paper was hard.
no. But see, this is I think proves one of the points that if you're someone who's well prepared in neurosurgery, a hard paper is good for you.
Yeah,
Because what happens is that in INI particularly, if you have worked on the neurosurgical part, then the harder the paper, it sifts you from the people who've just come out of general surgery, are very well versed, and have their advantage in NEET. So
mm.
INI is the test, and which just favors those who have actually read neurosurgery very well for neurosurgery. What kind of questions did you think were hard? Could you just name a few of the points or the
Sir, sir, they gave some question regarding some meningioma excision, sir. They are using angiography. They said that what filter was used and what filter is used and what is the wavelength of the filter. And
oh
that was and also there are many questions, sir. Like they gave about protoporphyrin 9,
okay.
like meningioma revolt. Some few questions are very hard, sir. At least like 15 to 17 questions were very hard. Few questions were very easy.
Yeah,
Very easy, sir. Few questions were very hard.
yeah.
Yes, sir.
So I think this time they went off and concentrated on the more of the operative aspect and the
Okay.
molecular aspect of tumors, which is uncommon to say the least. I mean, asking for filters and wavelengths is usually microscope technology. Like we use dyes also in those, so
Yes,
they
sir.
can be
I
questions of
sir.
dyes and microscopes. There must have been endocyanin and all the others, and fluoroscopy and all
I
of
sir.
the
Yes,
others.
sir. They gave that.
We don't normally cover that. We feel that if I give it, no, then there's too much for the candidate to cover. But I think then if
Yes.
this is the case, then we'll do a lecture on this, which becomes actually MCH final level. Like these are final level questions to execute MCH normally,
Yes, sir.
and take some amount of operative experience. And
Yes, sir.
what was did you had the general surgery paper as well, right? Or the
Yes,
or
sir.
yeah, how
General
was the general
surgery
surgery?
was general surgery was quite easy, sir. This time, at least I thought that general surgery will be hard. Like previously, 1 year back, they gave general surgery very hard, and there were only few people, 8 people were selected. I
I
thought
remember.
so. I gave much time to general surgery, sir. This time, matlab I gave 50% to general surgery, 50% to neurosurgery. So I expected more tough questions in general surgery, but the scene was reversed, sir. There were more tough
Yeah,
questions in neurosurgery, and they gave a question on 5 ALA, sir. What is the dose administered
no, for ALS.
for ALA, sir? 5 amino delta amino levulinic acid.
ALA. Okay, okay. All
Sir,
right.
they asked the dose. What is the dose administered? So these are I don't know, sir. I think these are not given in Greenberg also.
Yeah, that's what, because I wouldn't remember. The filters I can answer because we use microscopes very commonly, but
So,
5-ALA dosage remembering is even difficult for me because we
it is
don't
given
use it
in
very.
true or false, sir.
It's given in.
Like true or false questions, sir. Which of the
Acha,
following
acha,
statement is false?
true or false question. Yeah, that is
Uh,
still easier thing instead of the dose, but still, it's a very tough question.
but all the four options they gave, I couldn't identify even one, sir. I don't know even one option also.
Yeah, yeah.
So
No,
by
so
basic, by what I thought was fluoroscopy is green, so they might have used blue filter. So the wavelength is visible light is 400 to 700. So I kept 400 as the answer, sir. And I checked
Okay.
back in the internet, it was correct, sir. So some, I think some common sense also somewhat helped me, sir.
Right. Makes sense. No, so I think that's what. No, so when you have a paper like that, then it is absolutely essential that you can't even miss one of the easy questions. I mean, not
Yes.
even like mistakes up quickly. Everyone
Yes,
will
sir.
get this, and then the rest becomes your presence of mind, which I think you did quite well in, and whatever you can do correlative knowledge. Also, here, no, some amount of bravery matters. I mean,
Yes, sir.
there'll be
Yes, sir.
people.
Yes, sir. Sure,
Chance,
sir.
bravery matters in this regard. I feel.
Sir. And also in normally question, they in normal exam we'll get confused between two options, sir. In some of the
Yeah,
neurosurgery questions, I got confused from all four options, sir.
yeah,
I
that's
don't know
good.
which one to choose.
I think they're compensating for last year. No, I remember doing the interviews even at that time, and I just felt so bad that
Sir.
28 seats and only 9 people got selected. It's a waste of. Then
Yes,
I
sir.
spoke to my batchmates in various places, and they were also crying because they have no residents. I mean, seats available in top institutes, and guys who want to get through, they're not getting through, and they're not getting residents. It's useless. So this time,
Yes.
I think they did it on purpose.
Yes.
That they find the people who really do want to do neurosurgery. That's why
Yes.
they'll sift through them, right?
Yes, sir.
And how was the interview?
Sir, interview was fine, sir. They asked me some three questions, sir. The one major question, in that there is three sub questions. Around
Okay.
9 to 10 questions they asked. I told
Okay.
around 10 questions, sir. I didn't say 10 questions. I was able
Not
to
bad.
say all the 10 questions.
It was like an OSCE, this time I think. I'd spoken to a couple
Yes,
of
sir.
people
Yes, sir. Like ask you, sir.
like
Uh,
OSCEs. They stuck
sir.
to the script, I think. No,
Yes, sir. They didn't ask even from where did you did MBBS like that, sir. They straightforward went to the questions.
I think that's a good. I think that's a good change because what happens is even they're bored of the same answers, and I think testing the person for their knowledge is more important than trying to do an IAS type interview.
Yes,
So
sir.
it's good that way. How much theory was necessary for the interview pattern?
So theory, sir, more than 40, sir. More than
But
40,
it's-
40 marks will get selected for the interview, and based
yeah,
on
yeah.
that.
No, no. I was asking for the interview. During the interview, were the questions primarily theoretical, or were they like scans or photographs? How was the
Yes,
pattern of
sir.
the interview?
Sir, the first question they asked me about the coma, sir. What will you do? The patient presented with coma. What will you do? He has a
Okay,
scent of alcohol. So what will you do? Eh, What that is the first question, sir. And
right,
the
right.
second question, second question was regarding pupils, sir. They
Okay,
they gave one scenario. What is this? I said that is a Marcus Burn pupil. So what is Marcus Burn pupil? I said a
right.
swinging flashlight test, sir. And what that is indicate, sir? I said it's a second optic nerve lesion.
Good.
Like that, sir. There are some basic questions, sir. Few questions. They asked after Marcus Burn people. They asked Argel Roberts, sir, people, sir. I
Agal
got
Roberts.
confused. I got confused between that and IDs people. So I made that both questions wrong. Apart from that, I did good, sir. So I thought
No,
I got the basic questions wrong. So I may get less marks from 10 or 11, but they gave 18 marks, sir. Luckily.
so that's what now. So even if you get it wrong, they want to see if you've applied your mind. So you were close. I'm sure that even if you got it wrong, you applied your mind onto the mechanism of the Argyle Robinson's pupil and all the other kinds of. If you differentiate it from 1.5 syndrome, for example, they know
Hmm.
that you're applying your mind. You're on the right track. That's all they want essentially.
Sir,
So it's
they
good.
gave another one CT scan, sir. They showed subdural hemorrhage. They said, "What is the false localizing?" Sir. What is Kerhon notch phenomenon? I said, "Sir, it is ipsilateral hemiparesis." And they said, "What are the other what other false localizing signs, sir?" So I
Yeah,
said, "Subducens no palsy and compression of a posterior cerebral artery leading to cortical blindness."
perfect.
So,
Perfect. I think just
remaining,
if you had six nerve, they would have said six nerve palsy. If they said, okay, next question. That was enough for the first look like inside. And what
Except
else?
that to Argil Robertson people and Addis people, I was able to say the remaining portions. Sir. So I thought, so actually I thought my theory was bad and also practical was a bad experience. So I thought I should prepare for next exam. So I recollected all the questions, sir. So I thought I will start preparing for next question, but I was surprised for seeing. I was actually surprised. So
Yeah. If you can share all the questions, no, then we can do one lecture on the questions so the next batch can be really helped, because this time was a tough exam. Tough
yes,
exams
sir.
are always good for those who are preparing. So you have very similar experience to my PJ entrance, the one I got
Yes, sir.
through, because it was very tough, the neurosurgery paper over there. General surgery was easy, which really favored me. And even the interview, the very practical based. So it
Yes,
really
sir.
favors you if you've done well in your neurosurgery part. And how did you prepare? Yeah, how was your preparation? When did you finish your MS, and how did you prepare?
Sir,
Can you just give us a bit?
I finished my MS in the last August, sir. August or June, I
Okay.
finished. So I don't know, sir, what to take, what super specialty I am interested. I didn't know, but from the beginning, neurosurgery was my passion, sir. So, but
Right.
I thought after working in general surgery, I thought why to do extra hours? I could get some
Yeah.
skills by doing other MCH. I thought like that, but I couldn't like the other super specialties, sir. So I came back to neurosurgery and took the Marrow, sir. And
Right.
I saw your videos. They were very helpful, sir. Very helpful. And then actually I gave the last exam, sir. Well, I read only your notes and gave. I got
Yeah.
last time I got rank 30, sir. I
Oh, you
got
got
rank.
rank 30, not rank. I know rank
Sir,
30, right?
last time. Matlab, I prepared for some 1.5 months, sir. I just saw only
Okay, good.
videos. I thought I'll give a test and got ranked 30. I got selected for the interview. So I thought, okay, sir. And this time I read the Greenberg, sir. The
Yes, good,
extra
good.
that I did is Greenberg. To complete
Yeah.
that is somewhat difficult, sir. I couldn't complete. I could complete 60 to 65%. Sir. I couldn't complete the whole book, but what
Yeah.
they given was in your notes in that book, sir, helped me to. And the most important, I advise to do grant test, sir. Grant test.
Okay.
The more grant test you do, because grant test is not that about knowing the extra information. It know how much you control the time.
Right. Right.
Sir, during grant test, I used to complete my exam in 40 minutes, 45, sometimes 30 minutes. So I just
Yeah.
look into myself, sir. So why is this? I have so much time left. Why should we waste this time? So I started to do the bits slowly, sir. Slowly.
Right.
Then it benefited a lot. So it is not about doing hurriedly, but doing the right thing. Sir.
True.
Sir.
Like you're very right. How much time will you spend on a question, especially if it's a hard question,
Yes, sir.
and you get that acumen. No, ki if let's say you are very sure of two choices that are out,
Yes, sir.
I feel that you should always answer, because it's a
Yes.
50-50% chance on the others, and that will really make the difference, but especially in a hard paper.
Sir.
So I think you've done the right thing by practicing that point of nervousness when you get a hard
Yes.
paper, and it really favors you in that
Sir,
sense.
but
So,
there are some native also, sir. But I took 2 to 3 minutes per question. But in the last 10 minutes, I have to do 16 MCQs. Sir. New MCQs, I have only 10
wow.
minutes. So I
Okay,
thought
okay.
I just left everything. I prayed for 1 minute, sir. Please God help me. And
Excellent.
I did that in, I don't know, some 6 or 7 minutes, sir.
Okay.
So that is also bad, sir. So don't stick to that question. Only you have to give only, I think, maximum 1 minute per question, sir. Some first few questions I gave usually 5 minutes, sir. I read the question 5 times, 6 times. So I didn't do
Right.
that in the previous while doing grand test, but I don't know, sir. Some I don't know, sir. I got disturbed. I think I don't know. So that is
No, you're
also
so
bad, sir.
sweet. I'm so glad that you're telling people about the things that you shouldn't do, because that is the
Yes,
mark of
sir.
someone who really knows what they've done.
Yes, sir.
I'm so glad that you're giving this advice to people. And what actually happens when you give a paper, that is more important for people to know.
No,
But
sir, in the middle, sir, for what is the fast opening sign? If the answer is abdomen false, I would see it thrice, fourth, sir, 4 times. Matlab, the paper is hard. I should not leave even the small questions. I thought I wasted so much, so I don't do that. I want to tell people, sir.
sure, yeah, all's well that ends well. No, that same 1 minute of prayer, I think, has gone a long way in the
Yes,
last
sir.
16.
Yes, sir. And also, sir, my CT scans were a bit blurred, sir. I don't know the problem of the monitor or something. So I tilted the laptop, the computer like 45 degrees, sir. So I was able to say SDH. and I was able to see ring enhancing lesions. So they gave one CT scan. I
Okay.
saw only the skull, sir. I didn't see any brain. I thought
Okay.
for every people, I think they have published like that. But after completion of exam, I asked my fellow neurosurgery mate, sir.
Yeah.
He said, "Sir, what did you do? There were some CT blood images." So he said, "No, all images are fine." So I
Oh.
got disappointed, sir. So what for? They gave one ring enhancing lesion, sir. I
Yeah.
could
Yeah.
find what they gave one CT scan. They said, "What is this? What is the diagnosis?" There was only CT skull, sir, skull, and there is
They've given
so
you bone window. Then they've given you bone window.
yes, sir.
Ah.
There was no brain tissue visible, sir. That is, but the wall of the tumor was visible, sir. Contrast enhancing. So I thought,
Oh.
let us say this contrast enhancing lesion, a magical doctor. I said this could be glioblastoma multiforme. So I wrote the STUP protocol as the answer, sir. And
Hmm.
also another question, sir. Their
Yeah.
brain, they're somewhat visible, sir. Another question, there was so there was CT scan, sir. Only bone is visible, no brain at all. But they gave an arrow in the middle, sir. I thought
No, what has happened with you is they've given you the bone window. If you see CT
no,
scans, no,
no,
you get two
no.
windows.
No, sir. I
Uh,
asked after the completion of my exam. I asked them. They said there was problem with the monitor, sir.
that's what. No, it has come out to be bone window. It's very unfortunate, but I'm so glad you made it through all of that.
Yes,
Otherwise,
sir.
these get very angry about.
Sir,
Obviously,
in
yeah.
the question, sir, there was the arrow in the somewhat left side of the center, sir.
Okay.
The orbits and the left side of center. I thought there are
Okay.
some. I can rule out two options, sir. Third, the tuberous sclerosis and
Yeah.
vestibular schwannoma. I thought this could be Petrus part of temporal bone. So vestibular
Yeah. Yeah.
schwannoma might have been arising from it. So I kept vestibular schwannoma, sir.
Oh,
So
excellent. It's presence of mind. It's very wonderful that you managed to do that despite the
no, sir.
odds here.
Sir, after hearing my co-student saying that all the images were bright to me, there was no problem. I was devastated, sir. I couldn't be able to eat anything. I thought I should
Oh,
prepare,
but
but so I started recollecting the questions, sir, from
yeah,
that
yeah.
time. So okay, we'll prepare from next time. But luckily, I told sir, I was praying, please God, please give me some rank. I thought I
No, no,
was very shocked, sir.
it's not luck, buddy. I'm telling you, it's just presence of mind. And believe me, years from now, when you will enter the brain, not in for a very tough tumor, you'll enter the brain immediately. But when you enter the brain for a tough tumor, this presence of mind will come in handy when you can't see a nerve, but you approximately know that the nerve is there.
Yes, sir.
Then you will come in handy for
Yes,
you.
sir.
This kind of sort
Sir,
of common sense.
the neuroanatomy we should have a in-depth knowledge, sir. That I gave
Yeah,
most of my studies to neuroanatomy, sir. In 50% of uh, about 50% I gave it to neuroanatomy, sir.
great, 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 great. And I think both neuroanatomy in terms of the anatomy itself, and then in terms of the physiological anatomy of the tracts and everything
Yes, sir.
also. No, I think both of those are
Sir, sir, I recollected another question, sir. They gave anosognosia, sir. In neurology, they gave one question like anosognosia. What will
I know. So,
the anosognosia? They said
yeah, yeah,
what is the which structure is damaged in anosognosia? They gave occipitotemporal, occipitofrontal, occipitoparietal, sir. So we
parietal.
have to
Yes,
be
yes, yes.
careful about I read that in my PG neurology, sir. I thought,
Yeah, yeah,
chalo, theek hai, I will read neuroanatomy and neurology from PG. It also helped me a lot, sir. I could
yeah.
answer those questions.
Well, see, those are very nice. No, posterior column, no, basically. So you need to understand the test. We've done an entire. That's why we've done an entire clinical video for the first time,
Yes, sir.
and it's on right now, where we have actually made the entire clinical part
Yes, sir.
with a dummy patient, and that further on we have to take it to correlate it with theory. That really helps with the present pattern.
Yes, sir.
And good, yeah, me. You had a very tough exam and very tough circumstances and very tough odds, and despite that, you've
Yes,
come out on top, which makes it even more inspiring. I'm so
yes, sir.
glad.
Sir, and also not to boast, sir, but the rank one and rank two, the difference is 10 marks, sir. I thought, but it's not my about me, sir, because all the top rankers have read the same about me. But I
Yeah,
think the presence of mind, sir, that I could have left some 8 questions, sir, but I said, चलो ठीक है ये भी कर लेते हैं ऐसा बोल के मैं ऐसा कर दिया, sir. So
yeah.
I think it's
Hey,
something about luck also, sir. Luck and the determination. It's not about reading itself. I got to
yeah.
know this, right? I don't want.
No, luck, determination, definitely. But again, it is presence of mind, common sense. See, luck can favor you someday, it might not favor you the other day.
Yes, sir.
In this circumstance, luck did not favor you at all. But
Yes, sir.
it is the presence of mind that has really come out. And that's what you think, that that the paper is tough will not favor you. But believe me, sometimes it favors you a lot, because you have that, somewhere in your mind, something will click that this is the right answer. You won't even know what. That is the gut feeling, essentially what we talk about. Right. So just tell me something. You finished in August, and
Yes, sir.
that time you used the Marrow lectures, and you ranked 30th. Very nice. And then you continued to work in general surgery, or like you said,
No, sir.
for a week?
No, sir.
No. Then what did you do? You prepared.
Sir, I just prepared, sir.
You prepared. And so, what was your preparation like? Let's say first 3 months. Did you have a different pattern, and then did you have a different pattern? How did you pace that preparation?
Sir, I think I got something like 4 months, sir. So 4 months or something. So
Okay.
I started with your notes, sir. I completed the
Okay.
notes and I started Greenberg, sir. To be
Okay.
frank, it took around 1.5 months, sir.
Yeah.
To
How
complete
did you
even
do
60.
one? Did you do one full reading, or did you do like details of specific chapters? How was the time in which you progressed?
No, sir. So whatever you discussed in the class, sir. So I took back it to the Greenberg and read it, sir, full. Whatever you said from first line to line, sir. So I
Great,
underlined it. I read it twice, sir.
great, great.
So it is a very difficult. It is very hectic, sir. I got frustrated. Sometimes I could
Yeah.
read only half an hour a day. I got frustrated and leave it. I don't want this book. Then
Yeah.
it's very difficult, like, for the Greenberg part. But after reading it, I thought it was very beautiful, sir. So I did many grand tests. Many questions were repeated, and from
Right,
your notes and Greenberg.
right,
Sir,
right,
I
right,
would
right.
advise
So
Greenberg is a must. Sir. Greenberg is a must.
it's a must. We've all gone through it, and despite all, all your AIMS professors will say, "Oh, Greenberg, what kind of book is Greenberg?" But ultimately, such as it looks small, but it's a
Yes, sir.
very compact book. Fine, boring print, very small, lots of tables. So that one table will be like a whole day of memorization.
Yes, sir.
Um, but the amount it covers, no, it's
Yes, sir.
tremendous, tremendous
But
amount.
without your class, I think it is impossible to cover Greenberg, sir, because to memorize all that things, because you have made that very easy, sir.
That was one of the points here. We used to do it now without, when I was doing preparation, we used to do it without it, and it was so dry. You come out from general surgery, this
Yes,
very
sir.
dry book, subject that you have no idea about. You're reading
Yes,
about tumors you've never seen. At that time, YouTube also did not have so many videos on the operative
no,
part.
no. Yes, sir.
Now, though I encourage, go to YouTube, see those gliomas, see those oligodendrogliomas. You get some interest at least in what you're actually seeing in the craniotomies. So it's very good now, but still, that is a very dry book, but it's a wonderful book to cover.
Yes, sir. Yes, sir.
And so, tell me where you're from. Where are you from originally?
Sir, I am from Nellore, Andhra Pradesh.
Nellore, Andhra Pradesh. You did your schooling there?
Yes, sir. My whole
Okay.
schooling I did in Nellore.
And you did your MBBS from
Sir, I did my MBBS from Usmania Medical College,
Osmania. How was the
Hyderabad.
experience in
Hyderabad.
Osmania?
Sir, it is a very good hospital, sir. I got very clinical knowledge, the best
Oh,
clinical
good, good,
knowledge you can get.
good, 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 good. And then MS from AIMS, no?
Sir, AIMS Delhi, sir.
How was the experience in AIMS Delhi? MS?
Sir, MS was quite good, sir. It was hectic, but
Quite
it was good, sir.
good, yeah, very nice. Actually, COVID, I think you said no, couldn't do neurosurgery posting. Otherwise,
Yes,
AIMS
sir.
has the special that you can even do your AIMS and PJ, you can even do your thesis in neurosurgery, even in MS
Yes,
normally.
sir. Sir.
So that was something that I missed out. But then, okay, I think overall, still the experience of AIMS is quite good in terms of the vision and how much you can actually
Yes.
see in terms
Hmm,
of
sir.
the kind of things you can see. How much did your MS education help you in your entrance in your paper?
Sir, entrance I could. Sir, by doing MS, I can read Sabiston easily, sir. I was able to
Good.
read the Sabiston. When not hold the Sabiston, I can read some topics very easily, sir, because we used to do lots of surgeries, sir, from top to bottom, even thorax cases, renal transplantation, and all the cases we used to do. So we had a vast idea, sir. So it had helped me a lot, sir.
Wonderful, wonderful, yeah, excellent. So how's your family? Yeah. So what do your parents do?
Sir, my father is a aqua. consultant, sir. He see fisheries, and my mother is a
Okay.
professor in HOD of Department of Anatomy, sir, in the Nellore, sir, Narayan Medical
Oh,
College.
in anatomy. Excellent. Yeah, excellent. So parents must be really proud, especially your mother, being professor of anatomy, and
Yes,
with
sir. Yes, sir. Actually, I
did she
told
help?
them, sir. Actually, I told
Huh?
them, sir, don't expect. Actually, I told them, sir, don't expect anything. If I want, I said they were surprised, sir. They said that is this true? Is this true? They asked me like that. I said this is true.
No, no, I'm really glad. Did your mom help you out with your anatomy, neuroanatomy, and everything?
I said little bit, sir. Not much, to be frank. Little bit, sir.
Little bit. So, did you have a study circle?
Sir, yes, sir. For surgery, I had, sir. We made a three-member group, sir, in WhatsApp, and we used to discuss the previous questions, the controversies in only surgery, sir. It helped me in a lot, sir. Actually, few
A
questions
lot.
came from the discussion, sir. And
Okay.
sir, my brother also helped me, sir, because he is studying final year MBBS. So he asked
Okay.
few questions, sir. So I read it and tell to him. It also helped me a lot.
Excellent. 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 And so, what is your choice here? What are you going to pick?
That is difficult, sir. I didn't choose, sir. Actually, I'm thinking between Ames, Delhi, and Nimhan, sir. But a few people are
Yeah.
saying Ames. People are saying Nimhans. I have few friends in Nimhans. I have few friends in Ames. I don't know, sir. I thought I will go there and see the Bangalore, the city, and I don't know, real, sir. You have to help me, sir. I will ask you,
You
sir.
don't get to see much of the city, anyways. Okay. Most of the time, you'll be in campus. Bangalore is what is Bangalore is amazing, man. I mean, I've stayed in Bangalore for a bit. Did my education from Manipal, no, Karnataka.
Uh,
So,
sir, I need
so
your
Bangalore.
I need your help, sir. Please help me regarding choosing.
No, that I'll get you in touch with. You can get in touch with me separately. I'll get you in touch with people who are already there. People who have come as faculty for our discussions before. In fact, one of my best friends in NIMHANS. Another best friend has just he's taken VRS after becoming an associate professor. Joined Apollo here in the trust. So I know a lot of NIMHANS people. My friend Vasundhara, who came for the discussion for the interview,
I saw
she's in
some
Nizam.
MCQs, some MCQs discussion, sir. You said cranial weights, the pressure. I think the ma'am, is she the ma'am,
Yeah,
sir?
ma'am. No, she'd also come for the discussion for the interview, how to give the interview. This time also, and I think a couple of times back, if she's in Hyderabad, so she'll be able to like help you out also. And Ames Delhi, though, my batchmate Praneeth Kokla Praneeth, he's gone back to Hyderabad now, but he was MS Ames, MCH PGI, my batchmate, and then he joined Ames again as assistant professor, permanent faculty. Then recently, recently he decided to come to the private sector in Hyderabad. So I think he will be the perfect person for you to talk to,
Yes, sir.
and because he knows the professors, he's seen everyone, and he's done like you MS from Ames. So I think Nimhans has a good name in the south also. Like if you were deciding north
Uh,
side, then I would say definitely Ames Delhi. But if you plan ultimately that you might go to the south, I think Nimhans is also excellent, and the work culture is very good in Nimhans that way.
sir.
Ames is you'll see everything in Ames definitely. That's for sure. That you must know. So what is your schedule now? What is when is your counseling and all of that?
Sir, I do actually I don't know the regarding this. I think it will come in 20 days, sir. Actually, I don't know anything, sir. Sorry to say that, but I didn't.
Enjoy your 20 days, buddy, because you'll need it. And but you know what the good part about is that you had so much difficulty and you still made it to the top. I think
Yes,
this is a very unique interview that we've done with you. Things were not smooth. Usually we talk to toppers and things are very smooth for them throughout.
sir.
But for you, things were so challenging. Your screen was challenging,
Yes, sir.
and your questions were challenging. Your time difficulties. I think that will really inspire people
Yes,
to
sir.
practically and to keep their calm during the paper.
So that too, sir. I wrote two grand tests in Marrow, sir. I got first rank in both. I wrote
Oh,
three grand tests in another app. So I got
okay.
7-1. I did another grand test in another app. So I got second rank. So I thought I will get 1, 2, 3, so I can get in Ames or Nimhans. I thought like that. But seeing the paper, I was devastated, sir. I don't. But
I can imagine. And
sir,
tell me something. Just give one, if like just in general, what would you give a final advice to all the people who are preparing?
Sir, first is your notes, sir. I will recommend everyone to read your notes because I read that it is very helpful. And second stage is the Greenberg, sir. Whatever you
Greenberg.
have said in class, please revise those topics in Greenberg, sir. Next, do as much as grant test as possible, sir. To know the your can you control the time or not to see that, sir. You have to do
Right.
grant test, sir, because reading is one thing and the doing grant test in another, sir. So we
Right.
may
Right.
put a raw questions also in simple questions. So I at least do at least 5 grand tests, sir. So I did actually 19 grand tests, but at least do after doing 5 grand tests, I could maintain the tempo, sir. So and the last I could have 10 minutes or 15 minutes. There was time left for me, sir. In the starting there was 60 minutes time left. In the finally there was 10 minutes, 15 minutes time left, sir. So I thought it is good, sir. But don't go beyond that, sir. Don't waste your time more than 1 minute for a question, sir.
Excellent. Excellent. And one last thing, any other topics you would like seeing covered in the lectures? Because now this time, after a long time, they've given a tough paper. So, would you suggest anything that you thought that we could continue in the lectures? I would be more than happy to accommodate.
No, sir, that is a filter, sir. The instrumentation part of neurosurgery. Sir, they also gave one questions of Rane clips, sir. Craniotomy clips. They gave the image and said, what are the clips? They gave Bailey clips, Cheney clips, Rane clips. I read out
Oh,
only it once, sir. Luckily, in a YouTube video, I saw that, and he said that there are Rane clips. So I remembered that. Luckily, I saw one video, sir, like craniotomy video. So he mentioned Rane clips, so I was able to answer, sir. So instrumentation part, sir, like what is the position of the patient for pituitary surgery, positions and like that, sir. And also robots, sir. I think robotics also, sir.
robot, they gave a robot question for spine robot.
No, no, sir. They didn't give, but the grant test I did, they gave some questions about robotics, sir. Because and there are new like Neuralink, there are new technologies. I think they
Yeah,
also
yeah.
give like that, sir.
That would be wonderful because I just finished a couple of weeks back. I finished a complete operative lecture on pituitary, but
Sir.
and with the operative video, I think it should be on the app by now. But I think position wise, we just assume that it's endoscopy, so we just normally assume it's a supine position. But you're right. I should be much clearer, even from every single small step about
Yes.
it. That's good. And Rene clips are very interesting. I have a paper on Rene clips. I replaced Rene clip with scalp with just go online and check stationary binder clips in
Yes,
a
yes, sir.
position to Rene clips with my name. And it's one of the most read papers in neurosurgery because we've replaced very expensive Rene clips with
Yes,
very
sir.
cheap 2 rupees stationary binder clips, and they work very well. Was produced in
Yes,
World Neurosurgery. So we should. I think now there is scope to give all this because earlier I had started a lecture series for operative so that people can continue to use it during the residency. But I think now it's become with this paper, it's become essential even for MCH entrance.
yes, sir.
So that would be very good if we could continue that. And thank you
Sir.
for the feedback.
Sir.
And and if you come to Ames Delhi by chance, then definitely would like to meet up.
Yes,
Come
sir.
anytime, pour out your frustrations, and I'll send you all the numbers of people that you can call up.
Sir.
Residency is tough. Obviously, MS residency in Ames was also tough, but neurosurgery takes it up to a whole different level. Uh, but see everything. Even if you don't do everything, see as much as possible. Like
Yes, sir.
pull out as much juice from that fruit that you can by the time you finish. Otherwise, you're a hardworking chap. Yeah, you with a good presence of mind. I'm sure you will do extremely well wherever you
Yes, sir.
go. All
Sir,
right, and
also that is the sir. Also that is the reason, sir. Some my friends are saying in IMHANS that we'll get more hands-on in IMHANS. So please come. They said that to prefer IMHANS. Some people are saying like that, sir. So
see, NIM hands-on is definitely more NIM hands. There is no doubt. No, some friends. I'm telling you very practically, hands-on in NIM hands is definitely more. There's no doubt about it. Variety is the same in both Ames and NIMHANS. Ames only you get, that's why I say for the North, no, you get a tag of Ames Delhi. So that does matter. Ames, you get slightly more time recently. Recently, they have started a system where you get kind of your weekends off, which is rare. One Sunday or something you get off, which is rare in neurosurgery. NIMHANS, your earlier trauma used to be less because Bangalore Medical College used to take up a lot of the trauma, and NIMHANS was a referral center. But now they have taken up a lot more cases, and because of the hands-on, you'll do a lot of elective craniotomies also. So trauma becomes ultimately you will do as much trauma as you want later. So it's not
Sir.
going to be difficult for you. I'd suggest that I'll just get in touch with me through Marrow, take my number,
Okay,
and give me a
okay,
WhatsApp, and I will just send you the names of people who are faculty there, who have been faculty there,
okay,
and they can tell you exactly what is going to happen and what is not going to happen. All right. So that will be the
okay,
best judge. Once you go, man. It's all right. Enjoy. Come back after 3 years for your
okay,
fellowships, and whatever friends you make and people you speak to, keep in touch with them after 3 years also. Because wherever you settle, there'll be someone who's helping you. Now you work for the rest of your life. That think of it's not about entrance anymore. It's about succeeding in life in general. So good, yeah. But it's so nice to talk to you, and thank you for doing this interview with us. And I'm sure you'll help a lot. Please do submit as many. If you've written them down, just give a
sir.
photograph and send.
Sir, I
Great,
have
that'll be perfect.
recollected. Sir, I have recollected around 72 questions, sir. Around
Excellent,
from 80 questions. So I will
excellent,
share
excellent.
it.
Definitely, yeah. We'll just do a lecture and then we'll help out whoever's come out. And
Okay,
your
sir.
questions will help a lot more people become your juniors.
Yes,
They'll come to you. They'll say, "Thank you, sir. Your questions helped us out." And this
yes,
time,
sir.
questions are also hard, so we really need to do this for
Sir,
the
but
faculty.
I would advise my juniors to follow the basics, sir. Next time they may give the easy paper, sir. So don't get more involved in the hard questions. But first complete your basics. After that,
Right.
if you don't have time, leave the hard questions. First complete your basics, and you can build hard questions on that, sir. The foundation you have to lay down. I would advise, sir,
Excellent.
do not go straight into the hard questions. Read from the basics, your book, your notes. That is the first step to do. I would advise. Sir. After that, you can do anything. N number of textbooks, and also you have mentioned you should do another multiple MCQs, sir. But
Multiple.
I thought actually I took many books, sir. But there are many controversies, sir. They gave the right answer, wrong answer. So I got frustrated. I threw them away, sir. I threw everything. I just did your book and your notes and the textbooks.
When I was making those tests, no, the same thing happened. I got and ordered all the books available so
Sir.
that I'm able to cover all the questions that are already in the market. But the questions were so controversial themselves. Like the questions themselves, I found them to be wrong. Then I realized that the author is making up new questions. They're not
Yes, sir.
past questions, which is okay. But then when you make up questions, you have to have the scientific basis. Like you have to have
Yes.
read the papers or at least or have
Mm.
some clear basis. So then I filtered out and changed the questions somewhat. But I think the past papers will at least give you an idea of
Yes,
what
sir.
kind of questions will come. But this time, them considering operative is a very interesting change and a very welcome change. But I think we
Sir,
can.
sir, I told to for I forgot one thing, sir. You said the first
Yeah,
neurosurgery department was found in Vellore, CMC Vellore. What that was given as one question, sir.
that was
In
given.
the
Excellent.
I
Yeah,
remembered you, sir. Our sir has told this question, so I was very happy. In these hard
yeah, yeah.
questions, I got one known to
You
question.
got one.
I was very
One
happy,
this.
sir.
Then next time I'll do the whole thing. The first neurologist was Balwant Singh. So him and Chandy they created the Neurological
Oh,
Society of India,
okay.
and later on the Neurological Society of India became totally neurosurgeons. So now our society is called Neurological Society of India, but the neurologists have a different society,
Sir.
right? At the time we were all common. Very interesting history I've given on that. I'm so glad that it helped you out.
Sir,
Yeah.
and lastly, sir, I would like to add, I would like to ask whoever are seeing this, please do as many as national-wide contests as possible, sir.
Okay.
Because
Great.
if
Perfect.
other people know those questions, you also know that question, sir. Actually, 2 3 questions have came from that grant test, sir. So
That's
as
good.
many
Good.
as possible, you have to do grant test. That too, the national-wide grant test, sir. So you can grow your
Right.
ranks and sir, that is the last thing, sir. I wanted to say.
No, no, that's not lagging. It's a wonderful thing, and especially with the time management that problems that you had. I think that will also really help and keeping presence of mind. So basically, lectures, Greenberg, grant
Greenberg.
tests,
Grant
and
test. That's it,
retrograde
sir.
questions. That should
That's
be, I
it.
think, a very good preparation.
Yes, sir.
But so
No.
nice to have you, buddy. And we'll get in touch. And
Yes, sir.
congratulations. Any problems you have, let me know.
Sure.
So nice.